They're saying the NHS is facing a quad-endemic of emergencies as winter bites. In other words, it's winter. And once again, the NHS is squealing that it could be the end if they get any more pressure brought upon the hospital bed situation.
I think that we're reaching actually quite a positive moment in the conversation about the NHS, because for a long time you were not allowed to criticise it, right?
Yeah.
Nigel Lawson, one of Margaret Thatcher's chancellors, said that the NHS was the closest thing that Britain had to a national religion at various points.
Yeah.
I think that's probably right. And you get something like the bit in the 2012 London Olympic opening ceremony, where we had to all go and pray to the NHS
like
for a bit, and the nurses and all that stuff. And I'm sure many of the nurses in the NHS are great, many of the doctors are great. It's not to criticise the individual people.
No, but the NHS is not great.
No, it's not. It's
very
really
far
not.
from it.
It's very far from it. Nowhere else in the world has copied our model of doing things. And then you'll be having people going, oh, but the American system, blah, blah, blah. The American system is probably the only one in the developed world that's more dysfunctional than ours.
Yeah.
We're so desperate to copy
many
Europe.
parts of the American system work a lot better than anyone in Britain actually knows. And I speak as somebody whose mother was in the American healthcare system. I've been in it, and one of my children was born in it. You know, my sister lives there, she's in it, you know, and it's not as bad as people make it out to be.
Completely. But then they do so much right.
Yeah.
But if you go and look at the European system, so many people desperate for us to rejoin the EU and go, oh, they're so much more civilised on the continent, which isn't true, by the way. One thing they do pretty well is their healthcare systems. And the only time you hear stories about the winter crisis on continental newspapers is when they're reporting on the UK. So, you know, the idea that this is some kind of terrible thing, winter, oh my gosh, are people going to have the flu? Yes. Have we got jabs for that? Yes. And this idea of a quad-endemic...
And they're trying to get more and more people jabbed as if that's going to be the answer.
Yeah, I think in some cases it will be, but I think that what we've had is that since COVID and since some of the draconian measures put on us, we forget, you know, some of the messaging that came out. If you don't have this, you're responsible for killing granny.
Or you can't get on a plane, or you can't go in a restaurant, you can't go in a bar.
It's turned people off what is pretty good science.
Exactly right. Let's get a voice note from Sean.
Morning, Mike. Sean from Grimsby here. Does anybody actually know what he's talking about? Because it's just nonsense, man. I ain't got a clue what he even means. Maybe you can explain it, mate. Great show, mate.
I don't think I can. I mean, I'll try and get a hairdryer, maybe, and maybe we can sort of get a hairdryer on the show and try and explain what he's talking about via the use of a hairdryer. I'm not really sure. Paul says, what about the 5 pillocks of Labour? Yeah, that's a good one. Another story that we haven't even touched upon yet, front page of the Telegraph, 97%, this will come as no surprise to people who've been listening to this show for many years, 97% of town hall staff are still working from home. 97%. That's basically all of them, right?
That's probably the kind of the cleaning staff and the janitors are the 3% who actually have to physically go into the buildings. Look, I've got no problem if private sector businesses want to let people work from home. If that's what the top talent really wants, a day or two a week doing that, and that's what a market forces, that's fine. But when it's the central government, or in this case when it's local government, you have a responsibility as a senior person in those things to be physically present, to make the young people come in, so you can teach them, so you can train up the next generation of people. That's what taxpayers
and so that also they can be available for the public and be front-facing rather than be sitting at home, you know, stroking the cat or, you know, making a toasty while you're on the phone to them asking why your council tax is going up or why your bin hasn't been collected or why, you know, for the 3rd time in a row the recycling's all over the road and nobody's picked it up. And
this is at the same time as they're starting to try and push for a 4-day week because the power of the trade unions say we want people to have a 4-day week. If they're going to do that, by the way, they can be paid a 5th less for not working that extra day.
Yeah, and I think at the end of the day, I disagree with you about the working from home scenario. Yes, I know it suits an awful lot of people, and yes, many people ring in all the time and say you shouldn't be so anti it, you know, it works for me. Well, that's fine if it works for you, but, you know, we are all in this little collegiate world here. We live in a society which is a society. You're supposed to be part of something. If you want to just sit on your own and not do anything that's in any way sharing the wealth of the nation, and you don't want to go and buy a sandwich, or you don't want to go and get your shirts cleaned by somebody in the city, you don't want to walk into a train because the trains are so bad, you don't want to supply money basically to services that are good for everybody, then we all live in our little bubbles, and what you'll end up with is people who are rich getting richer and the people coming to bring your deliveries getting poorer. And I just think the whole idea is wrong.
No, I think that's a fair point. I think that the other problem, of course, is that if you live in, you know, a leafy suburb or somewhere and commute in,
got a lovely garden
like a lot of civil servants do, and all the rest of it, okay, I can see the appeal. And of course, if the cities you live in aren't safe because crime is getting worse, and as you say, if the transport is getting worse, then you see why people want to do it. So let's fix those sorts of basics and try and encourage people to come back in and make these enjoyable places in which to live again.
Yes. Speaking of the healthcare system in America, what about this story in New York that broke this week of the execution of the head of this health insurance company? An extraordinary story, but big piece in the Mail today has got this sort of explanation, perhaps, of the deadly grievance. Chilling words on bullets fired at the murdered health insurance boss that hint at why he was targeted. And the words are delay, deny, defend. Because that was a book, apparently, that was written about somebody, why insurance companies don't pay claims and what you can do about it. Brian Thompson was apparently involved in all sorts of, investigations. I think the government was investigating him for malfeasance in some way. They were looking into deals that he'd been doing, looking into the way the insurance company was being run. And I wondered when this happened whether it was some disgruntled, member of the public who's member of a family, maybe his family hadn't got what they wanted, but they've now got a pretty good picture of the guy's face, so they reckon they're going to be able to capture him pretty soon.
Which is absolutely extraordinary, and there is actually video footage of it happening. I don't suggest anybody this early in the morning goes and watches it, because it's one of the most awful things I've seen. But as you said, this idea that this person comes in and shoots, and then the bullet casings that are found on the scene have these words etched into them. I mean, it's like something out of a Luther episode, some kind of horror story going on.
It really is, because it's not just simply a random killing, as you would know that it wouldn't be, but to have the actual time to etch something into a bullet casing is quite
we're so lucky that this is actually still so rare in the Anglosphere, in the Western world, right? This kind of violence is actually fairly common in lots of other parts of the world, and then people will kill each other for a lot less. We're very, very lucky that it doesn't happen, and we've got to make sure that this guy is found and is absolutely prosecuted within an inch of his life.
Yeah, absolutely right. And finally, 6:59 practically, Greg Wallace is off the front pages. They've moved him back to page 10 of the Daily Mail, and he's going to be erased, apparently, for the next series of MasterChef. So after a week of front page coverage, the end of Greg Wallace and the story, hopefully, we won't have to read any more about it.
We'll have to actually focus on, the martial law declared in South Korea, the fact that Aleppo in Syria has fallen to rebels.
Yes.
BBC, actually big stories.
BBC won't know what to put on their website. And once again, the great news night going, we have approached the BBC for a comment, but we haven't been able to get one yet.
You are the BBC.
It's like just walk down the corridor with a camera and talk to somebody who's walking around in the newsroom. That'll help. James Price, thank you very much indeed. Great to see you.